So what I personally had done is over the muscle and the implant itself, but these are like a gummy bear texture, I guess you could say, but they're not hard. They're really, they still feel like it's liquid. But if you like poked a hole in it, nothing would leak. So that was really new to me. I didn't even know that existed. So that was kind of that was comforting, knowing that if for some reason I got a hole poked in me, that it wouldn't just like burst and leak everywhere. A lot of people's bodies aren't symmetrical, so that was just the cc amount that would make both of my breasts even. And again, Dr. Islur made all the recommendations as to what would be best for my body, but he was really good in guiding me through that process. A lot of the questions I had, I was worried about things like my boobs being super far apart with a big gap in between. You see that on some people. And I had a bunch of other different worries, or the opposite, where it's, you know, the uniboob. And I had all these questions of, you know, horror stories I had heard about or seen pictures of. And he addressed all of those concerns, and he explained to me that a lot of people get implants that are way too big for their body, and the doctor that they see is willing to do that, so then they go ahead and do it, and that's what can cause things to look really unnatural. Even actually when we were thinking about whether I needed a lift or not, he actually told me that he was going to decide during the surgery, because I was kind of at that point where I could have gotten a lift or maybe didn't need it. So he told me, he was like, I'm going to decide during surgery if it's necessary. And he really is like an artist, so it's not like he's just going in, oh, here's another boob job, on your way. He decided during surgery if I needed it, and I didn't end up needing it. Being a patient of his, I was really impressed with his communication. I emailed him a few times with questions, and he took the time to email me back personally. I think he was even emailing me, if I recall correctly, like the day before surgery. So you know that he really does actually think about his clients. He's not just, again, like coming in, checking the schedule, okay, we got a boob job, let's do that. He's really mindful of your specific needs. Another reason I chose to go with Dr. Islur is because in the consultation he explained some newer methods to me that I had never actually heard of, and that appealed to me because I feel like medicine, you know, and practices are always progressing, and we'll get into that more later when I talk about the recovery. When you're choosing a surgeon, of course cost is a factor. Don't base your decision on the cost. An analogy I like to use is once I was actually in a tattoo shop, and a tattoo artist was saying how people call in and just ask the hourly rate of the tattoo artist. And he was like, I don't know why people would base their decision on the hourly rate. Like, you want to go with the best artist because you are putting something on your body that's going to be there forever. You know, don't bargain shop. I personally, when I see a surgeon that has an ad in the paper saying like 30% off procedures or something, like, to me that's like, that's a bit of a red flag. To me, I don't think I want discount surgery.